Sweet. What's up, everyone? Welcome back to Let's Talk Teeth. Today we have a very special guest, Dr. Thomas Schlieve. Dr. Schlieve, if you don't mind introducing yourself, tell us what you're doing now, where you went to dental school, a bit about your background, and we could just go from there.
Sure. Thank you first for inviting me on the podcast. I always enjoy interacting with the upcoming dental community and shining some light on what we do at Parkland, what oral surgery does, a little bit about my background, how I got here. So I grew up in Wisconsin, very Midwest kind of upbringing, really never left the state much at all. And then initially wanted to go into pharmacy. The pharmacist told me don't do that. My neighbor was a dentist. He said definitely be a dentist. So I got on my path to dental school and went to undergrad at the University of Wisconsin, and then went to dental school at Marquette University in Wisconsin
Nice.
as well. And when I started dental school, very much wanted to go into general dentistry, had no thoughts about specializing
For sure.
whatsoever. Story short, did a whole bunch of stuff, ended up in oral surgery, and we can go into some of that detail if you want. And then did a fellowship in head and neck cancer surgery and reconstructive surgery in Knoxville, Tennessee. And then ended up here where I am now at Parkland, where I've been for 8 years. I think I've been the program director for 6 years. And I really believe that I have the best job in all of dentistry and, of course, oral surgery as well. So I'm really excited to go to work every
For
day
sure.
and interact with our
Sweet.
residents.
So was there like a defining moment where you were like, okay, yeah, I'm gonna do oral surgery, or that's the route you went down? So was there like a moment, or did it blend with school?
Yeah, I would say there are a couple things that kind of piqued my interest in oral surgery. One was I actually had a family member who had oral cancer
Wow.
and passed away from oral cancer. And then, like, how he went through that process, I started thinking about maybe how does dentistry get involved
Right.
in this? And that's what directed me a little bit more towards
For
oral
sure.
surgery. And then there were some good oral surgery mentors at Marquette. They were all private practice, but they brought me under their wing a little bit, started shadowing some oral surgeons, seeing what
For
they
sure.
did. And it was, to me, and it's maybe a little bit cliche to say this because everyone says it in their personal statements when they apply for oral surgery, but it's a mix between dentistry and
Right.
medicine, and it crosses those fields a little bit more than some other areas of
For sure.
dentistry. And that's what I really liked. It was almost like I wanted than general dentistry was giving
Sure.
me, and going into oral surgery put me in the hospital, which was a totally foreign world
I can imagine.
for someone in
For
dental
sure.
school. And yeah, and I loved it, and I loved it, and so
Right.
that's went.
Was the fellowship in mind prior to the residency, or is that something you enjoyed while you were going through it?
No, but interestingly, when I started my residency, I didn't really know that oral surgeons could do oral cancer surgery. I just thought I could be in it as an oral surgeon.
Spectator-ish.
Yeah, I had this. Yeah, I just had a vague, probably my fault that I didn't look into these things more. But a lot of my experience was with private practice organs prior to my residency. I was a little bit narrow-minded and only really applied to oral surgery programs in the Midwest and only 4 year. And then I ended up at a 4 year Midwest program at the University of Illinois Chicago. But then the best thing happened to me, which was the year I started. Dr. Michael Maloro took over that program, and he's a dual degreed oral surgeon. And he hired Antonia Kolakidis, who was a head and neck fellowship trained oral surgeon. So I walked in the door, and there were these two people there that I didn't even. And the residency changed. My perception of oral
For
surgery
sure.
changed. I decided medical school. I decided oncology and fellowship. And so I did my 4 year program and then went to medical school after because I had not been accepted into a 6 year program. But
Yeah.
I wanted
And
that. And so set that path for
so was
myself.
the medical school after residency just a way for you to bridge the knowledge gap for learning more about?
Yeah.
Yeah, that's wild. I've never heard
Yeah.
that type of
It
story.
That's
you learn so
crazy.
much in medical school. I tell candidates now, when I meet with them, or dental students when I meet with them, I was naive when I was in my 4-year program, and I just thought if I studied really hard, I'd learn everything that the people who went to a
Right.
6-year program and did medical school learned. I'd just pick it all up because I'd be working
Sure.
so hard. And you can't
Not
learn
possible.
that much information while you're doing you just have to go to medical school.
Man.
And for most of us, for myself included, I only did 2 years of medical school after my residency. I didn't have to do all
Nice.
4 years,
Yeah.
thank God. But then doing it after residency is a unique perspective.
Right.
Mhm.
And it really showed me how much I truly learned as a medical
Right.
student and how much my thinking about the patient evolved. And then I had to do general surgery again for another year, which you do one during your
Sure.
residency and you have to do one after your medical degree to get your medical license. So I had to repeat that year. And then I did my fellowship in oncology.
Oh, that's a crazy that's a crazy way to go about the position you're in.
Yeah,
Yeah.
I would not recommend. I don't recommend that to anyone.
Man, I did
It's
not.
the worst way to do
You're a bold
it.
soldier.
It's not a good way to do it.
Yeah, I did not
It
expect.
ends up taking you 7 years instead of 6 years
Yeah.
if you do it that
Yeah.
way because of the traits. But having an MD for what I do now, which is a lot of oncology and pathology, and I go to tumor board where it's myself and a radiation oncologist and a medical oncologist.
Right.
It helps in a perception that you have a medical degree.
For
It
sure. Understandable.
it
Yeah.
does. Because then when they look at you,
You got the
you're not
respect.
like the
Yeah.
weird dentist in the group.
Yeah.
Even though it doesn't change anything about your skill, if you're a single degreed oral cancer surgeon or a dual degreed oral cancer surgeon, it's just a perception
sure.
that people have.
Mhm.
And perception is part of the
Indeed.
game.
Yeah. Well, I got two kind of separate questions, but going off of what you said, so you finished your 4-year degree in OMFS. Where did you go? And was there like a entryway or like a pathway for people who are already OMFS trained to get into medical school? And another question I have is backtracking back to dental school. You mentioned that you were interested in oral surgery, or you mentioned that you obviously went through oral surgery, but at what point during dental school did you realize that this is the career you want to pursue? And what years did you do that? And how did you prepare during dental school for oral surgery?
I decided I wanted to do oral surgery during kind of mid to end of second year of dental school.
Okay.
And then I started looking into what does it take to get into an oral surgery program? What am I going to have to do to match, essentially? And back in the old days when I did all this, we still had a grade for our, so I didn't have to take the CBSE exam, which everyone has to take now if they want to go to oral surgery. So I just took my regular dental boards, and I knew I had to score. I knew if I got a 90 or above on that exam, I'd have a really good chance. So that was one goal. And then I knew I had to build my CV a little bit. So I needed some kind of leadership, something, some committee, something, some sort of research experience. So I sought out that. One of the oral surgeons at Marquette did research in forensic dentistry. So I partnered with him and spent some Saturdays just calculating tooth things for forensic dentistry. Did some community service, did some externships, kind of checked all the boxes that are on the list of things you have to do to get into oral surgery to make sure I got in the first time around. I really wanted to do oral surgery, but I really didn't want to do an intern year before going into residency. So I tried my best to do everything I could. And it's not rocket science how to get into oral surgery. You just have to do to check all the boxes. That's it. It's simple. And then to your second question about my medical school and kind of how that all worked out. So I was about a second year resident in oral surgery at UIC, University of Illinois Chicago, when I decided I wanted to do this medical school and then fellowship thing. Dr. Maloro reached out to the medical school at UIC on my behalf, and we started a conversation about what that would look like. And they told me I could take the MCAT and apply to medical school. And if I were accepted, I could petition for advanced standing, but there were no guarantees of anything. And med school there is really
Yeah.
expensive. It's
Right.
$80,000 a
Mhm.
year. So I said, no,
Yeah.
thank
Oh
you
my
to that
gosh.
option. Let's find something else. And thankfully, when I was coming out of residency, LSU Shreveport, where Dr. was the chair of oral surgery, he had a great relationship with the medical school, and he had for several years accepted a 4-year oral surgeon into that medical school. And it
Sweet.
was like a spot.
Yeah.
And so I interviewed with the dean of the medical school. I interviewed with Dr. Gali. I had to take the CBSE while I was a chief resident in oral
Oh my
surgery so that I
gosh.
could score high enough
Right.
to get into the medical school there. I had to get a set to allow me to start in third year of medical school, do my third and fourth year in Shreveport, and then I could do my. Now that program doesn't exist anymore, so I do get a lot of calls and emails from oral surgery residents around the country who are interested in going to medical school after their residency because there aren't very many of us who
Right.
did it, asking how they would. And unfortunately, I don't have a great
Mhm.
answer as to how that works now. It's really a case by case thing. Wherever you are, you're going to have someone who has a relationship with the medical school,
Mhm.
a good
Right.
relationship where they can
Pull some
kind of
strings.
convince the
Yeah.
medical school, yeah, that you're good enough to skip 2 years of school
Gosh.
and go only go there for 24 months. So it was just perfect timing. And the way that all worked out, basically, Dr. Maloro called Dr. Gali because they both write the Peterson's textbook of oral surgery, Peterson's Principles of Oral and Maxillofacial Surgery. They're
Mm.
the editors
Sure.
for that book.
Wow.
They know each other very well. Dr. Maloro called Dr. Gali, said, I got a guy for you.
Yeah.
And that was it.
That's crazy. It's hard to even wrap.
That is awesome.
And I got to live in Shreveport for 2 years,
Yeah.
That's the real
which,
win right there,
you
huh?
know,
There we go. So how did you
yeah, life
land your spot in
experience.
at Parkland? Was that kind of your goal, or how'd that opportunity arise?
Before I applied for the job at Parkland, I had never stepped foot into Parkland Hospital. I never externed there. I didn't even, but I knew that Parkland was just, it was a monster. It was busy. The residents were just like cowboys running around. And there were a lot of great oral surgeons in the history of oral surgery who came from
Right.
Parkland.
Mhm.
When I started fellowship, I had two options. One was go back to Chicago, to the University of Illinois Chicago, where I did residency, where I would work with Dr. Maloro and Dr. Kolakidis and help build
For
something
sure.
there. Or I would go to Parkland. And I basically just cold called the chair at Parkland, Dr. Zuniga, told him I wanted to come there. He said, send me your CV. We just had someone turn in their resignation. Let's, and it worked out.
Geez, what are the
Yeah.
odds that somebody was resigning too when that
Yeah.
that's happened?
Right? I had two faculty join my residency program who weren't there when I interviewed that changed my career, that got me into medical school at a place where it no longer exists to go to medical school as a 4-year
Right.
guy.
Yeah.
And then the year I did my fellowship, Parkland was looking for someone with my
Expertise.
specific
Right.
training to
That was
bring
meant
in.
to be for
Man,
sure.
your journey was meant for you.
Yeah.
Yeah, that is awesome.
Yeah.
But
So when people ask me like about my journey, I say I have no, because if I didn't do it
For
the way I
sure.
did,
yeah.
I would have finished a year
Yeah.
earlier and that job wouldn't have existed at Parkland.
Right.
So me taking this
Right.
long way eventually put me at Parkland
Mhm.
where I am today, and I love every minute of it and really am very appreciative to be a part of a historic
For
program like
sure. And
Parkland.
Yeah.
congrats. Dude.
So
The
my
capacity's
question,
huge.
yeah,
That's
definitely.
wild.
And so, what was the pull to do academia slash working in an oral surgery residency program versus going into private practice?
Part of it was I developed an interest in oncology, and really, although you can do head and neck cancer surgery in a private practice setting, it's much harder
For
Hmm.
to
sure.
do than it is in an academic setting. So that was part of it. The other part was my mentors, Dr. Maloro and Dr. Kolakidis. I really wanted to emulate the careers that they had. I saw them and what they did, and I had no exposure to that before I started my
Right.
residency. So I didn't know what I didn't know.
Hmm.
I only really knew private practice oral surgery, The programs I externed at were a little bit more limited in scope and how busy they were in the hospital. There was a lot more clinic based. So it meshed with my perception of oral surgery. And then I got to UIC and I realized that there was so much more. And that's just me being naive again, but there was so much more to it. I really loved being in the hospital. I enjoyed working with the other hospital services. I enjoyed the bigger cases, taking call, being in the ER. And then the biggest thing for me was the academic part of it, like teaching and scholarly activity. Every day in a residency is a challenge because you have all these hungry minds around you asking questions. Maybe they're not doing things quite the right way and you got to redirect them. If you're in your own private office, you just do it every day and no one asks you any questions. And if they are asking questions, they're not oral surgery residents usually, so you could just say anything and leave you probably. And I liked that challenge, that part, that being a part of a residency where we have grand rounds and we're presenting cases and talking about, okay, how do we do this better? Where did this go wrong? It just really spoke to me, that culture. And I ate it all up and dove in head first.
That's sweet. Looks like you've definitely found your passion, your calling, and the journey that you've had has been quite literally meant just for you. So kudos to you
Yeah,
for
I think
forging your own
it's
path and
fantastic.
doing the things you've been doing. So has it been different? Because you mentioned that you joined 8 years ago and 6 years ago you became program director. What was that? First off, what was that transition like? And second, how has that impacted your overall experiences at Parkland?
I always wanted to be a program director. Once I decided academics and I was going to go that route, I knew one day I wanted to be a program director and run my own residency program. When I started at Parkland, Paul Tawana, who's the current chair at Oklahoma's oral surgery program, was at Parkland as the program director. And my 5, 10 year plan was that he was going to be there for 5 years. He would maybe become the chair there. And when he became chair, he would have mentored me into this program director role. And I'd have a well run practice by then. I'd have a few years. And then a year and a half in, he announced he was leaving to take the chair position at Oklahoma.
Wow.
So the program director spot opened up.
Mm.
And I guess a lot of things, and I was in the right place at the
For
right
sure.
time to become a program director very early in my career. And I wasn't going to, because someone else takes that job, they might be there for 20 years. So I had to put everything into it to get that position and thankfully was named the program
For
director.
sure.
And once Dr. Tawana announced he was leaving and that I was going to become program director, he did then spend a lot of time mentoring me into that program director role. He had me sit on meetings with him. When we did the residency application cycle and interviews, he had me interviewing with him and reviewing applications with him so he could impart on me all the knowledge he had gained as a program
Right.
director. And that was super
For sure.
helpful as I became a program director. And I
Yeah.
still keep, when I left, I sit in his desk now, his old desk. And he left a note for me on the desk when he said that. And I keep that note like on the edge of my desk. And I just, every once in a while, I read it because it's just filled with words of encouragement and
That's awesome.
it gets me excited on a long day and things like that. When the residents are stressing me out,
Yeah.
to remember Dr. Tawana's words of wisdom. And then it didn't change a whole lot, except it added a lot of administrative that nobody really wants to do.
Mhm.
It's more fun to be the program director, but not
Have any
do
of the
the resident review
responsibility.
paperwork.
Yeah.
And
Understandable.
just hanging out with the residents is the fun part. But you do then, as the program director, and this is something Dr. Zuniga, who's the former chair at Parkland, still faculty there, had told me, the program really takes on the culture of the program director. Like you are going to lead this group and they're going to follow and it's really going to start to shape into a program that matches you.
For sure.
And that's been pretty cool to see the program change over the years to continue to grow, for us to become busier. I love operating.
Right.
So we get busier every year. because that's what I want to do. And those are the residents I take. And we keep pushing forward in that direction because that's the culture
There we go.
we're putting forth.
Yeah.
Sweet.
It seems like you've added your own personal flair to the residency program.
Yeah.
And it definitely, I could be wrong, but it seems to me, just based off, for those of y'all who can't see him, he looks like he's younger than me.
Yeah.
I mean, you're killing it at a stage so early in your career. It seems to already be program director at, quite frankly, one of the top OMS programs in the nation.
Thank you.
That is awesome.
Like I said, I enjoy it. I love it. It was when I was 20, I looked like I was 12, so that wasn't so good. But as I get into my 40s, looking young is a nice thing.
For sure.
Yeah.
Still nice when my patients ask me how old I am.
Yeah.
Are you old enough to be a doctor?
Keeps you motivated. So a little bit about the residency. What would you say makes Parkland special in comparison? Every residency has something special that they get to offer residents. And in your opinion, what do you think Parkland offers residents that they can look back at and be like, I really am glad that I decided to go to Parkland?
Other than they get to hang out with me for 6
That's a big
years.
selling factor.
Yeah. You may or may not know this, but my nickname is Triple D, which stands for the Dead Bone Doctor of Dallas. So you get to hang out with the Dead Bone Doctor of Dallas.
Yeah, no, I didn't know that.
Other than that, I think our program was started in 1952. And in 1952, very shortly after, it was one of the busiest programs in the country. It was a hospital-based program where we do a lot of operating room cases. And the culture was set at that point of what Parkland was going to be. And since that time, Parkland has been a top-tier oral surgery program every single year. So it's consistent. And we have had chair of oral surgery was R.V. Walker, the first lengthy chair. So one chair. Then Doug Sin became the chair, and he was a Parkland grad. So 2 chairs. Then John Zuniga became the chair. And just 3 years ago, Raleigh Filbert became the chair. So since 1952, we've had 4 chairs of oral surgery, all who kind of drank the same water of Parkland and believe in the same mission. So this consistency over many years has also created what I think is one of the greatest strengths of our program, and that's our alumni base. We've taken a lot of residents for many years. We have over 300 alumni, and they disperse all around the country because we really don't take many people from Texas. We take people from all over the place, and then they tend to go back to where they came from. And so when you finish the program, you have 300 alumni, and we take 5 residents a year in a 6-year program, plus a bunch of non-cats. And I calculated it out once, and you end up meeting like 70 people who are going to become oral surgeons while you're a resident here, plus all those alumni. Insane. You have this huge network. It's like the biggest family you can imagine, where you can call any of them and ask them for help, ask them if they're hiring, ask them if they lecture for Strawman or Nobel, to get you on the speaker circuit, if that's something you want to do, because someone has to introduce you to these things. If you want to be the world famous zygoma implant person, you're going to need someone to help you get into that. And there's a Parkland oral surgeon doing everything. There are more program chairs, department directors, and board examiners from Parkland than any other program. Part of it is we're big. Part of it is that's the culture that R.V. Walker started back in 1952. And it's just been a consistent powerhouse year after year. And I don't see that ever changing. It's been that way for quite a while, 70 years. So I think that's one of our biggest strengths.
Yeah. So let's switch gears here a little bit. So now we know about the program. Say you're a 4th-year dental student, taking the CBSE, killed it. What does Parkland look for in an ideal OMFS potential resident?
I'll do the on-paper stuff and then the off-paper
it's a good way to put it.
So on paper, you have to have a CBSE score that is the passing equivalent of step 1. That way I know when you come here and I send you to medical school for a little bit, No problems with step one, no problems with step two. You're going to fly through it and move on. Because the medical school reports all that data. That's part of a quality metric for medical schools. And so we can't have oral surgeons pulling down. That doesn't work. They'll kick us out of the medical school. There's no rule that we have to be there. They'll just say no more oral
See you
surgeons.
later.
You guys suck. We got to have some academic standard that I know or I can trust. You're going to pass step one and pass step two and move on. Yeah, we look at if you've got grades in medical school, or in dental school, of course, we're going to take that into consideration. Class rank plays a role. Last year, 44% of our applicants had no grades or class ranks. Just here we are. So it can help you or hurt you in regard. Undergrad stuff we look at it, it's part of your body of work that tells us who you are and who you've been through this whole pathway. People who were always at the top tend to stay at the top. People who have been a roller coaster, I don't know if you're going to be on the down or the up when you come to Parkland. It's easier to look at that trajectory when it's always been high. Our medical school does not determine if you can interview or if you can come to our program. But there are some oral surgery programs where that's true. Like the medical school can veto you, and they're looking at your undergrad because they don't care about dental school. They're comparing you to their incoming medical school class.
Wow.
That's the comparison. So if you don't hold up to their medical school class, you might get vetoed. And the program then can't take you.
For sure.
And there are programs where that's the situation. And then, the things I mentioned, you got to check all those boxes. So I tell everyone your CV, every line on your CV is worth 1 point. And you got to get as many points as you can get.
Yeah.
So you want to have lots of lines on your CV, things. Research experience is just that. It's experience. It's not publications. It's not world-changing research. It's research experience. So get some and put it on there. Do some community service. Do some externships. We all want people who've done externships because the idea is then you know what you're getting into. And I love people who've done externships at Parkland.
Sweet.
Because then I know that
what to expect.
You know what call is like. You know that you're going to work your butt. You're going to stay in-house. You're going to be in the hospital a lot. And if that's for you, then apply and come to Park. It's not for you, fantastic. Go somewhere else. It doesn't hurt my feelings. But don't waste my time or your time. That's why it's great to do externships in programs you're interested in.
Yeah.
You can rule them in, get an idea what's out there. And then we look at your letters of recommendation. Ideally, they're from oral surgeons because we think oral surgeons know what it takes to be a good oral surgeon. I'm not sure that's even true, but that way, if you have someone who knows your personality characteristics, like he was really generous in clinic, he shared his cases with his dental students, he had this really difficult patient and he showed empathy in this way or that way. That's not something I can pull out of your CV. So those are good letters to have if you have that person. And then it's off paper stuff. So when you come here for an externship, all the residents give me feedback on our externs. I meet with all the externs for quite a long time it's not really an interview, but it's a way for us to get to each other, to see if you like the culture, if you're going to fit in here, if we're right for you. And then I want people who are as excited about oral surgery as I am. Those are the people I want to come here. Who there is no amount of operating room surgery I could have them do that they would get tired. They would they're like, Dr. Schlieve, I'm hungry for more. I just love this surgery. And I think of it this way, no matter what you go into when you're done, you may decide all you're going to do is rhinoplasties, and you're just going to do only nose jobs 24/7 after you leave Parkland. That's fine. Or you're going to do only wisdom teeth. That's fine too. We're going to give you the tools to do. I want you to be the best at what you do, number one. But number two, isn't it cool to be at a residency program where you get to do rhinoplasties and where you get to do craniofacial surgery and where you get to do cancer surgery and where you get to do orthognathic surgery. And for the rest of your life, you'll have those experiences.
For sure.
And you may decide that cosmetic surgery, not for you. You did it. You did some facelifts. You did some brow lifts. Yeah, it was great. It was fun while you were doing it. You really enjoyed the surgery, but that's not your thing. But you got to, I don't know, to me,
The
that's exciting.
experience.
Yeah.
And I want people who are excited like that.
Sweet.
Does the typical residents know what they're getting into? Is it pretty busy their first few years and then tapers off towards the end of their residency, or busy throughout it all?
Yeah. So the way our program is structured, they're with us the first year and then with us like full time the fifth and sixth year, and then medical school and general surgery is in the middle.
I'll say,
General surgery is busy. You work 80 hours a week. You'll do night float and stuff. When you are an intern on oral surgery, you take in-house call. So when you're on call, you stay in the hospital. You don't go home. You may not appreciate what it means, but like my residents will get 18, 20 consults in a call shift.
right.
When I was a resident at the University of Illinois, Chicago, I took home call where I got to go home and sleep every day. And in a week, I might get called 4 times.
Mm-hmm.
And my residents get 20 calls in a single shift.
Wow.
It's just insanely. Parkland ER is the busiest emergency room in the country. And then we also cover Children's Hospital, which is the busiest children's ER in the
That's
country.
wild.
And we cover JPS Hospital, which is the 4th busiest ER in the country. And what that means is interns are really busy because shit rolls. Sorry for my language. And for every good mandible fracture that we get to do, take to the OR and repair that mandible fracture, we're all excited about it. There are 10 abscesses and lacerations and tooth pain consults that the intern has to go see.
Right.
That's sweet. Yeah. They never have
So,
a shortage
the
of
busier
patients.
you are,
Yeah.
never. The busier you are, the busier you are.
Yeah.
And so intern is very busy. And then when they come full circle, now they're done with general surgery and medical school and they're with us for 24 months straight in 5th and 6th year. It's very
For
busy.
sure.
It's very busy as a chief in a 5th year because we have, do you guys know what block time is?
I've heard of it, but I don't know
think so.
what it means.
So block time is where the hospital says, all right, this is your 8 hours to
I
operate.
see.
Like you get these 8 hours and this is on your day is Monday.
Mhm.
So in our entire program, we have 15 block days every 5 days,
Wow.
which means every day there are 3 operating rooms running simultaneously with cases
Oh, wow.
all day.
That
And so the chiefs are always operating. The 5th years are always operating or in clinic. They're like going this way and that way. They're all over the place. And that I love operating. I love to be busy. I don't like being idle.
yeah.
And so that's what the program takes on a little bit. But Parkland's it's always been busy. I just try to make it busier. It's just a very busy
Yeah,
program.
definitely.
So
And
like we've got clinic going while the OR is going. So you might be in clinic one day and the OR the next
Right.
day.
yeah.
So it's hard to say what a week is like.
Yeah. Much going if you're going to do a residency program, you're going to want to stay busy, in my opinion, see all the things you can. You got 4,
Yeah.
6 years to learn all the things that you're going to have to one day
Yeah.
practice and live through. Why not see
Yeah.
that a bunch of times a week, no matter
I believe
how
that 100%.
it'll only help in the long term is the way I see it.
Yeah.
And it's great that being in Dallas, you get to see a whole bunch of different cases. Y'all definitely aren't in a shortage of patients, which is always very useful.
Yeah, Dallas it's nice to be, it's a growing city.
yeah.
I love it in Dallas. I didn't know if I would like it.
Yeah.
I'd never really been here. I love it in Dallas. I'm never going
For sure.
north.
So, Dr. Schlieve, thank you for joining us. And I was just wondering if you had any mentors you could shout out or any last minute advice for maybe a potential dental student listening to this, something to look forward to.
Sure. Always, a lot of dental students will email me or reach out to me for advice, and I'm always happy to serve as a mentor. A lot of the externs, we keep in touch with the dental students. My mentors, of course, Dr. Maloro, the program at the University of Illinois, Chicago. I encourage everyone to go extern at that program as well. It's a little bit of a different flair than we have, but it's a fantastic program. And him and Dr. Carlson and Dr. Kolakidis they mentored me and they put me where I am today. Everything I have, I owe to them. And so they are obviously great mentors, and I encourage everyone to go hang out with those individuals. I always like to say to the residents, just do the appropriate thing at the appropriate time and everything will work out. So those will be my departing words of wisdom.
Sweet. Dr. Schlieve, thank you so much for joining us. It's been a pleasure, and I think we both learned a lot, and it's very inspiring to hear your crazy story, honestly, just from beginning to end. Everything worked out the way it should have, and I think you're making oral surgery a better place. You're making your program stand out amongst all the other programs. So keep doing you. I look forward to seeing all the amazing things you accomplish in your career, and thank you again.
Thank you. I appreciate it. Thank you guys for having me on the podcast, and hopefully I get a lot of listeners on this one.
Yeah, that's the goal.